Hey there, and welcome back to the Simple AI Guide, where we take the complicated world of artificial intelligence and explain it in plain English. My name is Hope. Today we are discussing something that may reduce your frustration and out of pocket expense: how to use AI to understand your medical bills, and how to fight back when those bills are wrong. Now, I know what you might be thinking. Medical bills? That sounds more like a finance topic than an AI topic. But trust me, this is one of the most practical, real world uses of AI that we have ever covered on this show. And by the end of this episode, you are going to have a clear step by step plan for using free AI tools to decode confusing charges, catch billing errors, and even write professional dispute letters without needing a medical degree or a lawyer. So, let's get into it. First, let's talk about why medical bills in the United States are such a mess in the first place. If you have ever received a hospital bill and had absolutely no idea what you were looking at, you are not alone. Medical bills are packed with billing codes, insurance jargon, and line items that even experienced healthcare workers find confusing. And here's the thing: those confusing bills are very often wrong. Billing errors in healthcare are surprisingly common. Hospital bills exceeding $10,000 carry an average billing error of around $1,300, and yet fewer than 1% of denied insurance claims are ever appealed. The system, unfortunately, works better when patients do not look too closely. What kinds of errors are we talking about? Let me walk you through the most common ones. First, there are duplicate charges, where the same service gets billed 2 or more times. Sometimes it is a data entry error. Sometimes it is just the way the billing software works. Either way, you should not have to pay for the same thing twice. Second, there is something called upcoding. This is when a provider bills for a more expensive procedure than what was performed. For example, billing for a complex consultation when what you received was a routine checkup. Third, there is unbundling. This is where services that should legally be billed together at a lower combined rate get separated out and charged individually, driving up the total. Fourth, there are phantom services, charges for procedures or supplies that were never used. This one is particularly frustrating because you are being asked to pay for something you never received. Fifth, there is inpatient versus outpatient miscoding. If you are treated as an outpatient but the bill reflects inpatient rates, you may be significantly overpaying. Sixth, there are incorrect CPT codes. CPT stands for Current Procedural Terminology. These are the universal billing codes that hospitals and providers use, and they directly determine what you are charged. A wrong code can mean a wildly inflated bill. And seventh, there are balance billing violations, where you are charged out-of-network rates even when the law requires that you receive in-network pricing. In 2025, journalists and researchers noticed something interesting. Businesses and nonprofits started launching AI-powered tools specifically to help patients navigate these billing practices. One journalist described it as a kind of robotic tug-of-war between patients and insurers. And that is exactly the playing field we are going to help you compete on today. So, what can AI do when you hand it a medical bill? Let me be specific. Number 1, AI can translate billing codes into plain English. CPT codes like 99232 or 80053 are meaningless to most people. AI tools can explain what those codes typically mean, what procedures they represent, and why they may have been used. Now, AI cannot always tell you with certainty whether a code was billed correctly in every individual case, but it can give you the information you need to ask the right questions. Number 2, AI can identify suspicious or duplicate charges. It can flag when the same code appears twice, when mutually exclusive procedures are billed together, or when charges seem out of proportion with standard rates. Number 3, AI can compare your charges to Medicare benchmark rates. Medicare pricing is a useful reference point for what procedures typically cost. The AI can help you see how your bill stacks up. Though keep in mind these are rough comparisons, not final verdicts. Number 4, AI can spot violations of Medicare billing rules. There are strict federal rules about what can and cannot be billed together, known as NCCI edits. That stands for National Correct Coding Initiative. Most patients have never heard of these rules. AI can help point them out. Number 5, AI can draft a dispute letter for you. This is huge. Once it has identified issues, the AI can write a professional, code-citing dispute letter that you can send directly to the hospital billing department, the kind of letter that gets results. And number 6, AI can explain your explanation of benefits. Your insurance company sends you an EOB, an explanation of benefits, after processing a claim. This document is notoriously confusing. AI can help you understand exactly what it says, what your insurer paid, and whether your out-of-pocket responsibility looks right. Okay, so now you know what AI can do. Let's talk about how to do it, step by step. Step 1. Request an itemized bill with CPT codes. Do not accept the summary bill the hospital sends you by default. Call the billing department and ask for an itemized statement, one that lists every single charge along with its billing code and dollar amount. This is your starting document. Without it, there is nothing specific for the AI to analyze. Step 2. Collect your explanation of benefits. Log into your insurance company's online portal or wait for the mailed copy. The EOB shows what was billed, what your insurer paid, and what you supposedly owe. Discrepancies between your EOB and your itemized bill are a red flag, and exactly the kind of thing AI is very good at catching. Step 3. Open a free AI chatbot and paste your bill. You can use ChatGPT, Claude, Gemini, or Grok. The free versions of all of these tools work fine for this task. If your bill is a PDF, some of these tools will let you upload the file directly. Otherwise, copy the text and paste it into the chat window. Step 4. Ask the AI to audit the bill. Now, this is where the prompt matters. The quality of what you get back depends a lot on how you ask, and we are going to give you the exact prompts to use shortly. But at this stage, you want to ask the AI to explain each charge, flag duplicates or suspicious codes, compare to average costs, and identify billing rule violations. Step 5. Cross-check with a second AI. This is a genuinely smart move. After getting an analysis from one AI, feed those results into a different AI and ask it to check the work. The logic is simple. Two different AI systems are unlikely to share the same error. If both flag the same issues, you have much stronger grounds for a dispute. Step 6. Draft and send a dispute letter. Ask the AI to write a formal dispute letter that cites each problem by name and billing code. Then do a quick spot check on Google for the specific rules the AI mentions. Medicare billing rules are public record and easy to verify. Send the letter to the hospital billing department and keep a copy. Deadlines matter here. Some disputes must be raised quickly, so check the date on your bill and the appeal rules in your plan documents. Step 7. Escalate if needed. If the billing department does not respond, escalate to a supervisor. If insurance is involved, file a formal appeal. And if your bill violates the No Surprises Act, a federal law we are going to talk about in a few minutes, you can contact the Centers for Medicare and Medicaid Services at 1-800-985-3059 or file a complaint online at cms.gov. Now let's talk about the specific tools that are available in 2026 for doing this work. For general AI chatbots, the ones best for translating your bill into plain English, your top 4 options are ChatGPT from OpenAI, Claude from Anthropic, Gemini from Google, and Grok from xAI. ChatGPT's free version handles bill analysis very well. The GPT-4o model, which is available on the free tier, can even read PDFs if you upload them directly. Claude is particularly strong at nuanced document analysis and drafting formal letters. Gemini integrates with Google Docs and Gmail, which makes it easy to save and send your dispute letter without extra copying and pasting. Grok has real-time web access, which is useful for looking up current Medicare rates on the fly. Now, beyond the general chatbots, there are also some specialized tools designed specifically for medical bills and insurance denials. The first is Counterforce Health at counterforcehealth.org. This is a free AI tool focused specifically on helping patients draft insurance denial appeals. You upload your denial letter and receive a professional appeal in under 60 seconds. It is funded by NIH and University of Pennsylvania grants, which means it costs you nothing. The second is Covered USA at coveredusa.org. This tool looks at your itemized charges and compares each CPT code to the current Medicare rate, automatically flagging overcharges. It takes about 30 seconds per bill. And third, there is Akuvera, which is a free app for iPhone and iPad. You can scan or upload your medical bills and get a structured breakdown of charges with potential issues highlighted. Now let's talk prompts, because this is where a lot of people get stuck. They open a chatbot, paste in their bill, and type something like, "What does this mean?" And they get a vague response that doesn't really help. The key is to give the AI a specific structured set of instructions. I'm going to discuss model prompts for you to use. Visit our website to get the full prompts. The link to this information will be in the show notes. The first one is the full bill audit prompt. You paste it into your AI chatbot, then add your bill. The prompt says, I'm pasting my itemized medical bill below. Explain every charge in plain English. Flag any duplicate or suspicious charges. Compare each charge to average or Medicare costs. Identify billing code errors or bundling violations under NCCI rules. Then draft a dispute letter I can send to the billing department citing specific violations by code name. Here's my bill, and then paste your bill. The second prompt is the EOB decoder prompt. Use this when you have your explanation of benefits. It goes like this. I'm pasting my explanation of benefits from my insurance company below. Explain what each section means in plain English. Tell me what my insurer actually paid versus what I owe. Flag any discrepancies between what was billed and what was approved. Then tell me if the patient responsibility amount looks correct based on the plan details shown. Here's my EOB, and then paste it. The third prompt is the code lookup prompt. Use this for any specific code you don't understand. What is CPT code? And then insert the code number. What procedure does it represent? Is it appropriate to bill this code for? And then describe your situation. Can this code be billed on the same day as CPT, and then the other code? And the fourth prompt is the verification prompt, the one you use to cross-check the first AI's analysis with a second AI. I've had an AI analyze my medical bill, and it found the following potential violations. Paste the first AI's findings. Please check this analysis for accuracy. Examine every detail. Flag any errors or anything that seems incorrect. Now let's talk about using AI specifically for insurance denials, because this is one of the most powerful applications. Insurance denials can feel like hitting a wall. You had a procedure, you thought it was covered, and then you get a letter saying it was not. But here's what most people do not know. Appealing a denial is often worth it. Many denied claims are reversed when patients challenge them. The problem is that most people either do not know they can appeal or they do not know how to write an effective appeal letter. AI changes that. Here is the process. Gather your documents, the denial letter from your insurer, the original claim or bill, and any relevant medical records or doctor's notes. Then go to Counterforce Health at counterforcehealth.org. Upload your denial letter. In about 60 seconds, the AI drafts a structured professional appeal letter for you, for free. Next, strengthen the letter. Paste the Counterforce draft into ChatGPT or Claude and ask it to add stronger medical evidence citations or make the tone more formal. Then, if possible, have your doctor co-sign the letter. A letter of medical necessity signed by your physician can significantly strengthen an appeal. Ask your AI to draft this letter as well. Your doctor just needs to review and sign it. Finally, submit via certified mail and through the insurer's online portal. Use both channels to preserve timestamps. If you do not hear back within 30 days, escalate to your state's Department of Insurance. Now let's take a few minutes to talk about your legal rights, because this is something most patients simply do not know. The No Surprises Act took effect January 1st, 2022, and established critical federal protections for most insured patients in the United States. Under the No Surprises Act, you are protected from surprise out-of-network bills for emergency services. You are also protected from out-of-network charges at in-network facilities, unless you were given proper advance notice and chose to proceed. Uninsured or self-pay patients have the right to receive a good faith cost estimate before services are rendered, and you have the right to dispute any bill that exceeds that good faith estimate by $400 or more, as long as you do it within 120 days of the bill date. If you think your bill violates these protections, file a complaint with the Centers for Medicare and Medicaid Services at 1-800-9-853-059 or at cms.gov/no-surprises. State laws may provide even more protection. New York, California, Texas, and Illinois all have state-level rules that go beyond the federal baseline. It is worth looking up the rules in your state. And here's an encouraging number. A study published in the JAMA Health Forum found that among patients who disputed a billing error, nearly 3/4 reported that the mistake was corrected. Most hospitals and insurers would rather fix a bill than deal with a formal complaint or bad publicity. Okay, before we wrap up, I want to address some important limitations and privacy considerations, because AI is powerful, but it is not perfect. First, AI can hallucinate. That means it can occasionally misidentify a billing code or cite a rule that does not quite exist the way it described it. This is why you should always verify any specific Medicare billing rule before including it in a dispute letter. CMS.gov and the AMA's CPT code database are reliable sources for checking. Spending 20 minutes spot checking the AI's findings is good practice before you send anything official. Second, AI is not a lawyer or a doctor. For very large bills, over $10,000, or with complex violations or any bill headed toward collections or legal action, consider hiring a professional medical billing advocate. Advocates typically work on a contingency fee of 20 to 35%, meaning they only get paid if they save you money. The National Association of Healthcare Advocacy, or NAHAC, maintains a directory of certified advocates you can search online. Third, and this one is important, protect your privacy. Medical bills contain sensitive personal health information. Before pasting your bill into any AI tool, consider these steps. Remove your full social security number if it appears. It should not be on a bill, but check. You can replace your name with initials or a placeholder. The AI does not need your actual name to analyze billing codes. Use temporary chat mode or incognito mode in whatever tool you're using if you do not want the conversation saved to your account history. And read the tool's privacy policy before sharing sensitive information. Especially for any tool claiming to be HIPAA compliant, verify that claim before relying on it. Let me quickly answer some of the most common questions we see about this topic. Can AI really help someone understand their medical bill without any medical knowledge? Yes, that is exactly what makes it so valuable. You do not need to know what CPT code 99232 means. The AI will explain it in plain English, tell you what it is typically used for, and flag whether it looks appropriate for your situation. People with zero medical background have used these tools to catch violations that would have cost them tens of thousands of dollars. How common are errors on medical bills? Common enough that it is worth reviewing most bills carefully. Different studies report different numbers, so treat any specific percentage you see as an estimate. What the research consistently shows is that a meaningful portion of patients who review their bills find at least one issue worth looking into. What if the hospital refuses to correct a billing error I found with AI? Do not give up. Escalate to a billing supervisor, then to the hospital's patient advocate or ombudsman. If the bill involves a No Surprises Act violation, file a complaint with CMS. You can also report billing fraud to your state attorney general's office or the HHS Office of Inspector General. The dispute letter the AI helped you draft gives you a paper trail, and that paper trail is one of your strongest tools. Do I need to pay for an AI tool to analyze my medical bills? No. The free versions of ChatGPT, Claude, and Gemini are all capable of analyzing medical bills and drafting dispute letters. Counterforce Health and Covered USA are completely free. Paid subscriptions, typically around $20 a month, offer additional features like direct PDF uploads and longer context windows, which can help with very long itemized bills, but they are not required to get meaningful results. So let me leave you with this. Medical billing in the United States is complicated by design, and for a long time, that complexity has worked against patients. Most people look at a confusing bill, assume it is probably correct, and just pay it. But now, for the first time, you have access to the same kind of analytical power that used to require a professional advocate, for free, in your phone or laptop. The next time you get a medical bill, do not just pay it. Request the itemized version, open a free AI chatbot, paste the bill in, use the prompts we gave you today, cross-check the findings with a second AI. And if there are issues, let the AI write you a dispute letter. You have more power here than you probably realized, and now you know how to use it. If you found this podcast useful, give us a like and follow us. Leave us your comments. If you want the full written guide, head over to AI4everyone.ai. The link will be in the show notes. And while you're there, subscribe to our free newsletter. Every week we cover one AI topic in plain English. No jargon, no hype. Just practical stuff you can actually use. This episode was written by humans and AI. It was read by an AI voice. Thanks for listening to the Simple AI Guide. Join me for the next episode.